We're talking with Dr. John Hollister, a pediatrician at Dartmouth-Hitchcock Manchester, about the flu vaccine and the HPV vaccine. Do you believe some people misunderstand facts about the flu or even what flu is? You know, I got the stomach flu. Do you feel that there's some misunderstandings there?
I think over the last 2 years, I think it's been clarified a little bit more, like in the popular press, exactly what influenza is. But still to this day, there's no question that people, when people say flu, most people think of stomach flu, which means like vomiting and diarrhea and things along those lines. But the true flu, real influenza, is more of an upper respiratory disease. So it tends to cause very high fevers, sore throat, cough, congestion, and a lot of achiness to the point where you feel like you got hit by a truck type of thing. And anybody that really has ever had true flu before really recognizes the fact that, yeah, it's a pretty significant entity. It really knocks you down pretty bad when you have it type of thing.
Now, Dartmouth-Hitchcock has recommended flu vaccinations for most people. Maybe you can clarify exactly what those recommendations are.
So we recommend the vaccine for all kids 6 months and older. Probably the key group that we concentrate the most on are kids between the age of 6 months and 2 years, partly because their immune system is still in the process of developing. So when kids between 6 months and 2 years get sick with the influenza, they sometimes get sicker than maybe you and I might get with it. The other groups that we really concentrate on are any kids with any sort of significant medical conditions. So kids with diabetes or children with asthma or other significant things which can make it so that either their immune system isn't quite so healthy as yours or mine, or they might have more difficulty sort of kicking off the influenza when they get it. But right now, we really universally recommend it for all kids over the age of 6 months of age, even though there are some groups which are more at risk that we really concentrate on.
So even though my daughter is almost 10 years old and has been relatively healthy, you feel that that would be important for her?
And I think of it in terms of not only like healthy for her, but healthy for the people around her. So if you think about flu as being something which is community acquired and something that happens within groups of people, if I'm immunized, it not only prevents me from getting the disease, but it also prevents me from spreading it to the other 5 people that are in the room with me. So for instance, I wouldn't want to be the person who accidentally, because I coughed in my hand and then patted a baby on the head, they'll be the person that actually gave it to a 2-month-old or something along those lines. So what I like about the influenza vaccine is it's not just helping me, but it also helps all the people around me type of thing.
And is it possible to have the flu or to be contagious and not even know that you are contagious yet?
Absolutely. In fact, like there's a lot of studies which show that probably the time that you're most contagious is before you show any symptoms at all. It's hard, and that's one of the reasons why these viruses are spread so easily from person to person, is before the person's even sick, they're probably already shedding the virus to a degree. The time when they're probably most infectious to someone else is when they have fever, but even for the week before, even like 3-4 weeks out, they can still be shedding virus to the point where they can be feeling better but still giving it to someone if worse comes to worse.
So I believe it was about 2 years ago, there was a lot of press about H1N1 called swine flu virus, and at least to my perspective, it seemed there was a big push for people getting the vaccine, and then in popular conception, not much happened. It wasn't a pandemic. It wasn't that big of a deal. Do you feel, well, first question is, do you feel that that truly was the case, that it wasn't that big of a deal? And the second is, with the passage of that, do you feel that there's a bit of a boy who cried wolf and people therefore are resistant to getting a vaccine because they were all told to do it and then nothing really came of it?
So I think H1N1 is a prime example of the medical community actually ramping itself up to such a large degree that it actually averted something which could have been significantly bad. So even though we sit here today and think, wow, really it wasn't as bad as everybody thought it might be, a huge part of that is the fact that the CDC and the immunization was developed to the point where we were able to vaccinate a huge number of people to try to prevent it from spreading more globally. So I think it's a situation, I agree with you, that the hard part is because we actually averted the big bad picture, like so that we didn't like have another, influenza pandemic of 1918, because we avoided that people sort of think, wow, it was not a big deal, but it was a big deal. There's no question that it had the potential of creating significant issues, like not only in the United States but across the world, and and it did to a degree. But because we vaccinated so many people, and because people were so much more aware of it, and were taking a lot of other significant precautions, whether it be better hand washing or whether it be coughing into your elbow instead of coughing into your hands, I think that there was so much education about it that we really averted, what could have been a potentially significant issue.
Is it the same? I know these are different strains almost every year, but sure, it's still possible to have a flu virus that's as robust as the one in, say, 1918?
Absolutely. So the hard part with flu is it's constantly changing. So the strains that are out there, there isn't just one strain that's there that you can then immunize against and you're immunized for the rest of your life. And that's one of the reasons why we have to do the flu vaccine every year, is that they essentially predict what the 3 most common strains are going to be. But for instance, if there's a strain that hits that hasn't been around in the United States in 100 years, then it's not one, first of all, that probably is covered by the current vaccine. But in addition to that, it's not one that the natural immunity that all of us have had basically built up against. So as a result, it has more potential for more people getting it. It's spreading easier and causing significant more disease and illness.
One thing I've heard is people saying, well, the vaccine this year is pretty much the same as last year, so why would I ever need to get it again this year?
Yeah. So it's an interesting thing that I sort of scratch my head about, because I do think that because we vaccinated with H1N1 last year and we're revaccinating again with H1N1 as one of the strains in the vaccine, I do think that people are probably still have some protection from last year. But when you think of really trying to prevent something, you definitely want to boost things to the point where you're at your highest sort of ability to fight off the infection. So I still recommend giving the vaccine on a yearly basis so that you have the ultimate chance to sort of fight off something.
I understand that here at Dartmouth-Hitchcock Manchester, there's actually some research going on about flu vaccine. Can you tell me a little bit about that?
One of the reasons why I love working at Dartmouth-Hitchcock is because we continue to try to evolve what we're doing medically. And the medical center up north is active in a lot of different research projects. One of the current ones actually has to do with the 2 different types of vaccines which are currently out there. One of which is a shot, and the other one which is currently a nasal spray. So they're doing research right now trying to figure out which one might be actually more effective in terms of not only preventing me from getting the influenza, but also possibly the people around me getting influenza. So the nice thing, it really does do it. They're doing a different research protocol right now, which probably a study which will come out in publication in the next year, which will have comments about those sort of things. But that's one of the things I love about being here, is that they can continue to sort of move medicine forward, type of thing. So
some of the research that Dartmouth-Hitchcock is doing around flu vaccines might have an impact not just at Dartmouth-Hitchcock but nationally.
Yes. So as a result of the studies that we do here, they will make recommendations. They won't just be done in New Hampshire, but really across the nation, type of thing. They oftentimes do research studies like in a number of different locations and pool all the information. But yeah, it definitely will make a difference in terms of what we might be recommending 5 years from now as far as like flu vaccines are concerned.
One of the recommended vaccines for children, or maybe it's more for adolescents, is HPV. Could you tell me what HPV stands for?
HPV stands for human papillomavirus. It's a virus which is known to cause cervical cancer in women. Over the past few years, what's been the new vaccine which is out there that we've been using is actually a vaccine that can prevent the most common strains of human papillomavirus. So the nice thing about that is it actually has the potential of actually preventing cancer, cervical cancer in women. There's very few situations where you can actually, sit down and say, wow, we can actually prevent a cancer. And this is one of them. So human papillomavirus it's a sexually transmitted disease. So it's something which is mainly, children are mainly at risk when they become adolescents and become sexually active. As a result of that, we give the vaccine sort of in the early adolescent years, thinking that we want to build up their immunity, in preparation for when they eventually become sexually active.
And so at what age is it recommended that they get this?
So we currently make it available for all girls at the age of 11. It's also available for boys, but currently we're only doing the situation where if the moms or the child asks for it in the boys. But we're trying to universally start it at the age of 11 for girls. Once again, because the three-shot vaccine, it's one that you have to have a certain amount of timing between. So in order to really build up their immunities to the point where everything's all set by the time that they're older and become sexually active, we try introducing it at an early age just to basically get it done so they're well prepared for their later years.
So it makes sense that this is a possibility of preventing cervical cancer in women. Why would you have boys get the vaccine?
Boys are the primary carriers of HPV. So the way that it's spread from one person to the next is going to be through the male partners. So if you think about it in terms of, once again, in terms of public health, the way to prevent it from actually being spread from person to person is to prevent the carrier from spreading it from person to person. So it's not just about preventing a woman from getting infected with HPV, but it's also about preventing it being spread from person to person.
Do you find that parents of 11-year-olds have trouble visualizing that their children will be sexually active in the next 4 or 5 years?
Yeah, I have 2 daughters of my own, and I never picture them ever being sexually active. So there's no question, like in my mind, yes, I think it's a difficult leap of faith for any of us to take and to look at our little children and think of them as being adolescents and adults later on. So I think sometimes it is a hard leap of faith where you basically say, I'm going to be preventative and do this now for when my child is significantly older.
What do you say to those parents in that sort of situation if you're trying to convince them that this is an important thing to do?
Once again, I stress the importance of how great it is that we're actually able to prevent something which can cause cancer later on in life. And I try to take them out of the thought of thinking, well, I've got to think about my child being sexually active, and really think of it back to the basics, which is that we're trying to prevent a disease which then can prevent a cancer later on. So if you think of it really in terms of, just like with any disease, you want to try to give their immunity early before they actually are at risk for actually getting the disease. So if you think of it in those terms, I think it's a little bit easier to talk with parents about it.
One final question about the HPV vaccine. Where is it actually administered?
Sure. It's administered in the arm. So by the time kids are 11 and teenagers, usually we have enough muscle mass that we're able to give it in the arm. So it goes into the deltoid, either in the left or the right arm, depending on what the child wants. It's just like with all vaccines, because when we give vaccines, it's not easy. It's a little bit of a pinch when it goes in and things along those lines. But when you think of the benefits of actually, doing the vaccine and preventing things, it's well worth it.
This Healthy Highlight is brought to you by Dartmouth-Hitchcock and Ledyard National Bank, working together with our community partners to improve your well-being.